morning, everybody, and welcome back to Sunday Mornings with Mike. We're so pleased that you've joined us. My name is Peter Walsh. This is Mike Handler, the Emergency Management Director for the town of New Canaan. I wonder, as has been our custom, we might start with some prayer. As I say, we're going to pray. I'm going to pray from my tradition. I ask that you pray from your tradition. And if you have no tradition at all, or no religious tradition at all, I ask that you send your good energies and thoughts to those in need. So let us pray. Keep watch, dear Lord, with those who work or watch or weep this morning. Give your angels charge over those who sleep. Tend the sick, Lord Christ. Give rest to the weary, bless the dying, soothe the suffering, pity the afflicted, shield the joyous, and all for your love's sake. Amen. So, Mike, welcome back. I am developing a real friendship with you over what has just been a crazy 8 weeks. Yesterday in the phone call, you noted that we have been in pandemic mode for 8 weeks, and that a lot has happened over that 8-week period. I wonder if we might just start and just there. You know, in 8 weeks, we've done a lot of stuff that's been really terrific.
Yes, we have. And first, you're not just a friend, you're an essential friend. You're the only person that I've actually seen outside of my immediate family for the last 6 or 7 weeks. But it's nice to be back. Last night's message, I hope, indicated to New Canaan that we are and have been taking steps that are required to make sure that we can open or reopen portions of our economy as safely as we possibly can. And when I mentioned the word apprehension, I share that apprehension as well. This is not, this is a novel coronavirus. By definition, it's new, so no one really has definitive answers on what the next steps are going to look like. But there's a lot that needs to be done to do this with minimal risk and to reduce the risk to what's acceptable. And we work every single day, both Jen Eielson and our doctors that we work with and our Jack Hennessy, our fire chief, Leon Korolkowski, our police chief, we work around the clock to make sure that we can actually protect, to the extent that we're able to, everybody in town. And it's not easy because a lot of what we're doing is unknown. It's uncharted territory for all of us. So the message last night, and I'll tell you, there's definitely and you probably feel it as well, because you have your fingers on the pulse of the community. There's definitely a strong desire. I'm not sure if it's spring or it's 7 weeks or it's the stock market rallying. It's something's indicating to people that it's now much different today than it was back 8 weeks ago when we started this endeavor. And it's not to say things aren't different. There are a lot of things that have changed, and for the good. We have dramatically increased the capacity in our hospitals. There's no question about it. Yep. Again, we take great pleasure in seeing that the Stanford Hospital intensive care unit beds have dropped by 20 or 25. From the 60s to the 30s. It's great. But in a typical year, they had 12 or 13 patients in the ICU, so we're still way above what normal intensive care unit presence in the hospital would look like. So we're looking at data points, and we're trying to read and glean information that can tell us when it's a smart idea to open. For right or wrong, I think the global population wants to get back to some semblance of what they used to have in terms of freedoms to do what they want to do. I don't think our job in New Canaan is to encourage that faster or to slow it down even more. Our job is to be as prepared as we possibly can be. So the things that we wish we had to reopen quicker would be proven antivirals and therapeutics that work, and a vaccine that we can all have some immunity in the community. That's not going to happen anytime soon, so we've got to really figure out what else we can do to protect people. We've started, masks are a big one. I mentioned on the call last night, we gave everyone a mask so that you can't use an excuse that you don't have a mask when you go out in public. People have then asked, I've seen every question that's been asked of me about, do I have to wear a mask when I'm taking a shower? Do I have to wear a mask when I'm running on the track? Do I have to wear a mask when I'm rowing on my rower at home? People need to recognize that that mask protects other people. And what I've said all along in our discussions is that this is about risk. And if you want to take risk that affects you, then by all means, it's a free country. Do what you got to do in your own home. If you're not hurting anybody else, take the risk. But in this instance, it's vastly different, right? So the risk that we take affects other people. So again, I see and I hope I'm wrong, but maybe if you look at Michigan and other parts of the country, you're seeing the extremes play out. I think New Canaan is far more sophisticated than that and far more empathetic than that. But I think we're starting to see a small, surge of people that are disbelievers on what's actually happening. And that is not what I intended to have come out in the call last night. I'm a firm believer in the science. I know what we did and why we did it. Going back to that flatten the curve from the beginning, it saved lives. If you look at Sweden as an example today, unfortunately they're seeing a surge in cases and a surge in fatalities relative to their neighboring Scandinavian countries. And again, they chose to go the route of very little social distancing and isolation and go towards the route of trying to get herd immunity, and it doesn't appear to be working out as well as they would have hoped. But we can't forget why we're doing what we're doing. We're no safer today than we were before. We're just tired and we're frustrated, and because of that, you got to be extra careful, right? If you walk a tightrope as a career and you're always vigilant about safety, when you get tired, that's when precautions go out the window and you make a mistake, and we don't want to allow New Canaan to make that mistake. So wear a mask. It's for you to protect others. Do not, and I say this because I see it in my house. So if I'm doing anything, we'll drive and we'll take the kids for a ride over and wave to my mother through the window at her apartment. And my kids are like, there's someone without a mask on. We should stop Dad, tell him to wear a mask. And the whole idea is, it's good. I mean, you want your children to say, hey, Billy's not wearing a bike helmet, he should wear a bike helmet. That's great. But I do not want to see citizens interfering with other citizens because they have a different view of what's critical and what's not critical. I talked to the Service League of Boys yesterday, and great group of young men and really impressive group. They've always been very helpful to us in town. Unfortunately, there's not much we can do today because we want everyone to stay isolated. But my message to them, and it's to everybody, is to be role models, right? The best thing you can do right now is stay healthy. And if you're going to be out, wear masks and be role models. Don't go after other people that aren't wearing masks, but just show people why it's important that you do wear a mask. And you should know that when you wear a mask, you are protecting other people, not necessarily the young people in our community, but unfortunately the at-risk population, the seniors and those that have pre-existing medical conditions. And that data is unbelievably telling.
So thank you for all that. So in that, you've touched on so many different topics. One is different countries having different approaches, the more lax countries having a greater fruition of the virus.
Appears that way.
Appears that way. And so that is over here. And then the second one was you just glanced on Michigan. You just touched it, and I'm not sure everybody knows what you mean. What happened in Michigan? I know many do, but maybe not everybody knows.
And it's not just Michigan. In other cities throughout the country, we're seeing protesters. And it started probably a couple weeks ago in isolated cases, but it's getting bigger. And unfortunately, in certain parts of the country, people are showing up armed, and they're demanding their God-given right to go out and open their business and go out and go to a movie theater and go bowling and do the things they're used to doing. Listen, it's not that I'm not sensitive to the needs of people, and I certainly appreciate the fact that losing your job or losing your business or losing your retirement is just as damaging to one's health and psyche as a pandemic can be. But we're in unprecedented times, and this science, I do believe the science. I generally question, but I always generally come down on where I think the science has it more right than wrong. If we just opened up our economy today, we'd see the death toll rise dramatically. The numbers that we were talking about, were they overstated at the onset? Perhaps, but there's no doubt in my mind, just on the local experience, that we've saved countless lives by not continuing the way we're used to continuing throughout this. So in Michigan, there are unfortunately people showing up en masse to their town halls and to their state capitals demanding that we reopen or they reopen the economy, the local economy. And that's a very tough battle because you're putting your law enforcement, your first responders in positions they should not have to be in, number one. Number two, it's diverting critical resources to deal with things that are not top of the mind right now. So again, I don't anticipate that happening here. That's why we live here. But it's certainly something that we have to keep in the back of our minds. And I think if there's one thing that I'm doing, it's hopefully balancing a kind of a neutral tone to the messages that yes, We're still in a health crisis. We haven't made as much success as people like to believe we have. And we're going to start to re-engage in a measured way, but take the precautions you can and do not put yourself in harm's way when you're trying to tell people that they're walking too close together, or they don't have a mask on, or they're not practicing social distancing. So I tried to make light of it last night with someone not carrying a 6-foot tape measure like you and I did on the very first time we met. But again, it's their guidelines. They're meant to be taken seriously, but they're not meant to put yourself in harm's way to enforce.
Yeah. Thank you for that. Just everybody out who are listening here this morning's stream, what Mike is referring to here is feedback that he received. He receives a lot of feedback for the calls that go out, intended to be neutral. Mike, I would just say, as I mentioned before we started, that I think your calls are a little bit like a Rorschach test, that people lay their thing on you or on that call as you try to unfold for everybody.
Is it a test I'm taking or that they're taking? Who's taking the test?
I got a lot to say about a Rorschach test, but I'm just going to take a pass here on that one, even though they did give it to me in first grade. But anyway, so just want to say I can sense from some of the town Zoom calls that we have at 4 o'clock in the afternoon that there, as you pointed out, there's this great surge of people just like at the starting gate, ready to go, and some are over the line already, some are running, some are standing back. They want to open it up. We're talking about that in what does that mean in practical terms for the town of New Canaan? Each town has to deal with this. We're talking about outdoor tables, dining at 6 feet, plastic forks. Just a comment about the plans for such a thing, and how does a plan get put together? How does the town execute that and unfold that?
So let's keep in mind that the majority of the guidance and the restrictions will come from the state. So we are awaiting a decision by the governor as to what this next phase will look like. All that we've been told, and we've had a lot of discussions about it at the state level at different bodies, but pretty much we've been told that the whole world is going to be looking at a new metric in terms of being able to at least feel compelled to allow certain things to open up. And that metric is one that you and I haven't talked about in the past. It's, we've kind of invented a new data point to anchor to, and because it's going to tell us what we want to hear, and that is they're looking at statewide declining hospitalizations, 14 consecutive days of declining hospitalizations. Now that is certainly a data point that we followed all along, and it's certainly a good data point, but we're going to make some statewide decisions, right? So it doesn't mean that what happens in the southeast portion of the state is what happens in the southwest portion of the state.
Oh, yes.
They're vastly different segments of the population with different exposures to New York and different infection rates, certainly. So again, I think that's a data point that happens to work towards reopening. It's not the only data point. It's probably not the best data point. The best data point would have been, adequate testing and seeing a true decline in infection, which we must be seeing because we're seeing a decline in hospitalizations, but it's a 3-week, 4-week lag for that to happen. So, which is, again, it tells you where you are today is accurate, but what a window of risk to recalibrate if things don't go right? If you're waiting for hospitalizations or fatalities, God forbid, to tell you that you opened too fast, you will have a month's lag. So the lives that we're saving today are a result of the work we did 3 or 4 weeks ago. It's not the work we did today. So without adequate testing in the community, it's very hard to get a more fingers on the pulse of what's actually happening. So that's the first issue. So the state.
And let me just pause you there, and thank you for that. And again, the timetable for adequate testing.
Again, people ask me all the time, when will we do antibody testing in town? When will we do more fervent diagnostic testing? It's when it becomes readily available, when we actually have the capacity to do it, and when the tests are actually accurate. A lot of people have confused motion with progress, and they jump through hoops to get antibody testing, to be the first to do a full community of antibody testing. That's great. Unfortunately, it's got a 30% false positive rate. So when you have those kind of numbers, it still tells you something, but is it worth all the effort to go through it? If you don't get a conclusion at the end that's one way or another that tells you what you can or can't do, it's kind of an exercise in futility. So we have been very patient, and I think in emergency management, no one understands this, but I think going back to the 9 years I've been doing this, I'm almost more proud of the things that we as a body have not done as opposed to things that we actually get credit for doing. And no one sees the things you don't do, right? It's the absence of something that is hard to measure. But there are a lot of things that people have done that it feels like they're doing something because everyone wants to take action. We don't. We tend to let our departments lead the way until they can't handle anymore, and then we kind of step in and help out. But they're very good at doing what they're doing. Other towns just want to jump in and get firm action and make sure they're doing something. We've done a lot of nothing, and no one notices it. And antibody testing in the last 4 weeks would have been absolutely useless. So that's one of the things that we, and again, we've got good doctors and good guidance from our experts that kind of tell us, get ready, prepare to do it. But until the product is available, there's no point in actually getting there and rushing to do it.
Okay, so we have thank you for that. So we have the 14 days. We don't have any timetable for that, and on you go.
So now the state's talking about what they're going to reopen. I suspect on Monday they'll make a decision on schools. Why we've waited this long and created anxiety, I'm not sure. But for whatever reason, we haven't made a decision. So I started by telling you it's the state's decision on how to set the guidelines and
Right.
the executive orders. That being said, the town has some flexibility. So we can be more restrictive than the state. Generally speaking, we cannot be less restrictive than the state. So for example, if the state says no schools will open for May 20th, we can't suggest in New Canaan that we've got a better experience than others in the state and we'll open May 19th. We could, however, say our experience is worse than other parts of the state and we'll choose to open May 21st. So we can go more strict, we can't go less strict. And that's for good reason. Otherwise, you would literally not need a state government. You have 169 towns all making their own decisions and have no coordination. Now, I don't suspect that would work out well, and that's why I'm disappointed with the way the federal government's response has been. Because a lot of the stuff that the state's doing should really be a federal government decision, not a state government decision. But like testing, like contact tracing, people don't just stick to their town. They don't stick to their state. They cross borders, and being able to contact trace across borders is very, very difficult.
Interesting.
So, long story short, procurement of PPE is probably the most classic example of why this never should have been a local responsibility, a state responsibility. It should have been a federal responsibility, and we're about to repeat the exact same exercise in testing, which scares me. But as far as what the state's going to open, the governor's put out some very preliminary data that on May 20th, he's inclined to open restaurants to outdoor seating. It's a challenge because the thought process is that the inside of a restaurant is generally confined. There are fire marshal codes for seating capacity, and they have to do with square footage of the restaurant, number of restrooms, and emergency exit and egress capability. Outside, I think every doctor and every expert would tell you that the virus has a much lower incidence of spread when you're outside. It makes sense to me. But what I suspect is you're going to see a massive accommodation by towns to afford restaurants more outdoor seating than they ever had before. So, and I think it's a great idea. There's some things that can be done that are really remarkable. We could close Forest Street, we can close Elm Street, we can literally, a couple days a week, have the seating right out into the street and have it really be a really interesting environment, but for the fact that we're in a pandemic. Right? So it'd be very quaint to close Forest Street or Elm Street and have restaurants outside and have music, and it'd be beautiful. How do you stop people from congregating and strolling through and wanting to take a look and see what's happening? Very tough to do. We're going to try to do it in a very wise and intelligent way, but again, it requires enormous cooperation. And when you see things happening in Michigan, that tells me I don't see that community having a very high probability of cooperation. New Canaan, hopefully we can balance something different. And I think my message to everybody, on behalf of all of us in emergency management for the town, is that we're going to try to do this in a measured way. If it turns out it doesn't work out the way we intended, then we'll have no choice but to rein it back in. And that's not our intention. Our goal is to start measured and advance as we progress and see a couple weeks into this, if we don't see higher rates of infection, we can continue to relax a little bit. But if we do, we'll tighten things back up. And people have to be aware it's going to be a fluid situation. We're not going to just make a decision it's going to be set in stone for the next year. We're going to measure it to the best that we can. And just please keep in mind that our yardstick isn't perfect. We don't have a perfect tool to measure what the impact is going to be as we start to social gather again. So wash your hands, wear your masks. If you don't feel comfortable with outdoor dining at restaurants, then don't go to outdoor dining in restaurants. Make decisions for you and your family that you think are appropriate. But if we don't allow certain things to reopen, they're going to open in their own way. So eventually, water goes where it wants to go. You can't stop it forever. So you're going to have to figure out how to do this in a measured way. And my hope is that with the guidance from the state, the town will continue to be very thoughtful in how we do this and try to, A, encourage businesses to earn a livelihood again, but also to protect the public as best we can.
So thank you for that. As I understand it, we're talking about restaurants. I did listen in on a call where they were talking about what does it take to have tables 6 feet apart, how much room is on the sidewalk. I mean, it was pretty complicated, frankly.
It is. You know, restaurants are tough businesses to begin with,
I
right?
wouldn't.
So
Don't
most
go in the restaurant
restaurants can
business.
barely make it without turning their tables 2.5 times and have 90% capacity. You talk about 25% capacity in a restaurant, that's not a very viable business. It might help people stay employed and lose less money, but it's certainly not a viable business. So it's not the solution, it's just a means to get to a solution.
So we have, you've brought up restaurants in all the matrix of decisions around that. We've got schools and all the anxiety around that.
Non-essential retail?
Okay, that's where I was heading. Let's just name some of these other things here
So
that
non-essential retail. So essential retail has been open. Grocery stores, pharmacies, we've done what we can to protect the staff and the supply chain, but also those going into those establishments. And again, that's essential by definition. You have to go in and get food. You have to get pharmaceuticals. So non-essential retail is going to open. And again, just because you open the door and put the sign on the door doesn't mean people are going to come in and shop, right? So no one knows what the experience is really going to be. And I suspect, and I've heard arguments both ways, it could be a massive flooding because everyone's dying to go to the Gap to buy a sweater again. Or it could be no one's going to go out and shop because it's not essential. I don't know what's going to happen. But I would just remind you that this is always about risk. And I think I mentioned to you, I risk coming here to talk with you because I think it provides a value to the community. You're the only person I come to talk to. I spend time with my wife and my kids because they're my family and I'm willing to take that risk. But everybody that I see, including you and Jill, I assume when I see you that you're positive. Because that's in my defense mechanism in my brain is that's how I know to stay away and not touch something that's hot. You should assume that everybody that you see is positive, and you should take precautions to wash your hands, stay 6 feet apart, and wear a mask. And then you should also not see them unless you absolutely have to. I mean, that's just common sense to me. So if I need to get something that I can't acquire online or somewhere else, then I will go into a store and purchase what I need to purchase. But that's a level of risk each individual person is going to take and make for themselves. We're not going to make it for them. At least the state's not going to make it for them.
Very interesting. So we're talking about the so-called non-essential retail. I had mentioned to you before we got on the stream golf courses, because I hear agita around golf courses. Is golfing an essential business?
Is that a Yiddish term you just threw out there? Yes. So early on, I think it was most important, at least I'll speak for myself, it was most important for me to have a consistent message to everybody in town that if 4 women weren't supposed to be sitting knitting, 4 men shouldn't be playing golf. And again, it's not to say that only women can knit and only men can play golf, but the imagery of having people play golf when we're shutting everything else down, to me, sent a mixed message, which I wasn't really fond of. The golf courses were never closed by the state, so that gave them a different level of protection. But I'm very fortunate that our golf course and neighboring golf courses closed voluntarily. They have since, and again, it's easy to close voluntarily when it's raining every day. As soon as it gets nice out, it becomes a tougher ask. So I think it's getting nicer out. People are getting cabin fever. People are saying, if I'm paying my dues, why can't I go out and play golf? If I'm playing with my family, that's fine. But I don't suspect everyone's playing with family members. So again, you got to take a level of risk that you're comfortable with, knowing that the people you're playing with are positive also. So if you want to chase a white ball around the grass and take that risk, and that's the risk you're going to take, I just suggest you wash your hands. You stay 6 feet apart, and there's no reason why you can't wear a mask. People have given me a lot of reasons. There's a lot of science, that's cropping up overnight about how it's advised against wearing a mask when you're running, against wearing. A lot of people have reasons why they should or should not do something. Use common sense, do the right thing. I think if you were to run, if you're an avid runner and you're trying to break the 3-minute mile, then wearing a mask probably is not going to be sufficient. But if you're running on South Avenue and you have a mask down, like you're wearing yours now, you're probably fine 90% of the time until you come across someone with 3 baby strollers walking across the street, pull your mask up and run by them and be polite. I'm asking people just to be sensitive to other people's needs. And again, it's not you I'm worried about, it's the seniors and the at-risk population that we have to be hypersensitive to.
Yes. We're going to come to the questions in one moment here. I just, since we're on seniors, just want to say a word about seniors and seniors in our community, Waveney and Silver Hill, and all the institutions
Sure.
that take care of our seniors and are the homes for our seniors?
I think it's important at this point to just take a quick pause and just honor the staff at our senior housing, assisted living, skilled nursing facilities. They are always do unbelievable work, but this is really, they've always done unbelievable work, never with their own health and life at risk. So I think it's important to recognize the value they provide to our community, and it's immeasurable.
Amen.
I also think it's important to not look at the data that I provided as a means to assume or to judge that work that's being done at any skilled nursing facility in the country is not being done properly. I think two things, and I've tried throughout this entire process to draw the conclusion that I want people to see in the data, but I'm also mindful that data is just data, and if I give you the raw data, you can come to your own conclusions yourself, so I provide both. The data at Waveney Care Center, and second, because first is thanking our staff members and our caretakers, but second is we have to really be empathetic and sympathetic to the losses of family members, of seniors that have been lost in a way that they've never envisioned being lost before. So alone, with staff members, with telecommuting to family members, it's a horrible thought that you probably have to deal with more so than I do, thankfully. It's really I could not imagine what that is like. But I also draw the conclusion that social distancing really does work, right? Because we're seeing a predominance of infection and fatalities among the population of nursing home residents versus measured up against the number of, certainly measured by the percentages of seniors that live outside of the nursing home, we're seeing a much lower rate of infection and fatalities. What does that tell us? It doesn't tell us that Waveney Care Center is bad or it's unhealthy or I wouldn't send my mother there. It fills a different need, and I think, and it's been pointed out to me rightfully so, that we should be focusing more on the demographic and less than the actual residency of where someone lives. Anybody that is home, anybody that's in the risk category of a senior and high risk with comorbidities, the risk factors are numerous, but the top three would be obesity, diabetes, heart or lung disease, or some kind of depressed immune system. That population has a very bad outcome with this illness. So COVID-19 just ravages people that have pre-existing comorbidities. So if you're home and you're isolated and you don't need outside care, you have a much better chance of not getting infected. If you're home and you do need outside care, anytime anybody that you or I see is positive. Anybody that you see in a hospital, those doctors and nurses, they're positive. Anyone you see in a nursing home, those people, you assume they're positive. The rate of infection is going to go up by definition if you're exposing yourself to more people. So it should not be a surprise that when you have people living in a high occupancy, residency with shared caretakers, you're going to see a higher rate of infection. That's just going to happen. It does not imply at all that any staff members have done anything inappropriate or wrong in the way they provided care. It just means that that's the reason why social distancing actually works. But some segment of our population cannot be isolated in quarantine because they require care. And that's unfortunately borne out by the numbers. So again, I would not hesitate to put my loved one in a nursing home if that's where they need to be to get the best care. This is just a very unfortunate time. And again, the staff members that are caring for residents that are afflicted with COVID-19 are also exposing themselves to great risk. On top of which, people need to be discharged. Most of the residents from a nursing home or a skilled nursing facility are coming from a hospital, right? Most people that have a hip replacement, at that age are not going home to recuperate. They're generally going to a rehab facility to recuperate. So, whether or not they're getting exposed to that in the nursing home or in the hospitals or in the, ride back from the hospital or from visitors, and they shut visitors down early on, which was good, but, they're at risk because they're exposed. And when you get exposed in that category of the population, the outcomes are very, very bad, and very bad. So the inverse of that is people should not. It would be a mistake of monumental proportion to assume that you're perfectly safe because you're not living in a nursing home right now. That would be an absolute misstep in terms of judgment. This infection and this virus is highly contagious. And it does have, again, it's not just seniors. We're seeing some cases of 21-year-olds and 30-year-olds that are passing that, historically have had very little the disease process that they've had to deal with. So whether they had something we didn't know about, we won't know for some time. But this is a tough disease. So we talked about re-engaging society. No one's talked about the elephant in the room, which is that segment of the population that has pre-existing conditions, seniors in particular, need to really still remain isolated. And that is going to be something that's not going to be taken very lightly. If I'm spilling it for the first time here on this show, then I apologize. But I'm telling you, if we start to see large numbers of our at-risk population back re-engaging society, we're going to have to really rethink this, because that is the group that is most at risk. So if you're 95 years old and have diabetes and you need a new sweater, you better not go to the Gap to buy a new sweater. We better find a better way to do it, and that's on us to help figure out how to solve that problem. I think we've done a remarkable job on bringing food to people, and Bethany Zaro and her team, and Jen Eilson and Brian Lutzy and everyone collectively has done a remarkable job helping us, and the 400 volunteers we have, remarkable job helping us kind of keep that at-risk population at home for the essential needs they have. It would be really disappointing to me personally if the at-risk population chose to come out for the non-essential needs because we opened up a couple of things that seem enticing. So again, we have a lot of work that remains to be done. So I do not think we're going to see bingo halls are not opening anytime soon. So, and we got to just be mindful that to the extent we have shuffleboard courts in town, we better really keep an eye on them, because I know people want to get out.
Right.
People want to get out and do stuff.
Right. Yeah.
Okay, so speaking of getting out, the first pretty straightforward question regarding the masks. So if you have a choice between a cloth mask or the ones that the town handed out, which is preferable?
There's no difference in terms of protection. The only difference is one lasts longer than the other. So if you think you're going to get through the next year, and I did say year, with this mask, you're crazy. This mask, if you wear it once in a blue moon, you go out, you can keep it on your rearview mirror and use it a lot. But if you are going to be out and a lot wearing something that Peter's wearing now that you can wash and keep in rotation, is probably a better bet.
Okay, and speaking of that, last week after we were finished, somebody had asked for a little more information about the mask, Peter, that was sent to you by from overseas. I think that you have there the red mask.
Oh yeah, I just put the red mask over there.
Oh.
This isn't that funny. My kids have all gone to schools where they've had many roommates from Asia, and one of Gus, my fourth kid, his sixth grade roommate at the Eaglebrook School, Hilton Chow, lives in Taiwan, and his parents run a daycare facility in a tower in Taiwan. We love Hilton, and Hilton started to send us masks, because in Taiwan, where they really worked hard to take care of this. He felt that we weren't taking care of ourselves properly in the United States, so he sent us masks. They were made by 3M, and I can't tell you exactly what kind of Chinese lettering was on it. But so Hilton, our 25-year-old friend, 24-year-old friend from Taiwan is taking care of us. That's where the mask came from, and we're all wearing Hilton's masks.
Do me a favor, next time Hilton mails you something, give me a call. Let me know what's next, because he seems to be ahead of the curve a little bit.
Well, we also got all kinds of great ramen noodles here too. So, but anyway, keep going.
Okay, so this is a question about statistics. Speaking of the vulnerable population, number one, are there statistics from any country that demonstrate that some people in their 70s or 80s or over have COVID-19 but are symptom-free? And also statistics from any country that demonstrate that elders have had it, never knew it, and now have antibodies? And if so, are those people still vulnerable?
So let's take the last question first. The World Health Organization, whether you believe them or not, has indicated that it's unclear if having antibodies from prior exposure provides enough immunity for you not to get sick a second time. So we don't know that, whether it's true or not. It remains to be seen. I think most doctors, including the ones in town, believe that having been exposed to the virus and produced antibodies, they're neutralizing antibodies, that you have some level of protection. Whether it lasts a day, a week, a month, a year, no one really knows. A lifetime, like measles, no one really seems to know. That's the first thing. As far as the data on seniors and those at-risk populations, the answer is I have not seen it, and it's not surprising that I haven't seen it. We haven't seen it because we don't even have adequate data on those who are actually sick, let alone those who have gotten better. So we're not, I'll give you an example. The early policies on healthcare workers returning to work, or nursing home staff returning to work, or public safety officials returning to work after they've been exposed or tested positive used to be 14 days isolation and then test negative 2 consecutive times before you go back into circulation and work with people. That policy has been changed 3 times now. Why? Because they don't have enough tests to test someone the second and third time. So the new policy it actually changed 4 times. It was 14 days isolation, and then 72 hours, no symptoms, without any fever reducers, you can go back to work without being tested. They then reduced that to 7 days isolation, 3 days, 72 hours of no symptoms without fever reducing, go back to work. Why? Because they didn't have enough healthcare workers. They were keeping people out of circulation for too long. They've since realized that the population in the hospitals have declined. They've now raised it up to 10 days of isolation with 72 hours of asymptomatic, without fever reducers, you can go back to work. So ideally, this is a roundabout way to get into the answer to the question you're asking, ideally we would be testing everybody before they go back to work. But we don't have the testing capacity to do it. So because we don't have the capacity to test seniors that have gotten better. We can't test healthcare professionals that are on the front lines. How do we test patients? So I would imagine at some point in the near future there will be a study that will tell us what that means. We're not there yet. I think the smart, prudent position to take is that if you are over 60, I don't know what senior is anymore. It was 80, it was 70, now it's 60, whatever the number is.
Not 60.
It's not 60.
If you are a senior, and more importantly, if you have any of the pre-existing conditions that have proven to provide very poor outcomes, you need to isolate and not think that you're immune because you may have been exposed. And I'll tell you something else, personal experience. Now, we thought a family member had COVID-19 back in January. Textbook. I would have bet the house on it. Turns out, antibody test came back negative. So again, we thought we were exposed. I would have told you I had some level of exposure and some immunity, and it turns out I don't. We've had healthcare workers, doctors, that have declared they were symptomatic, rightfully so, had textbook symptoms for COVID-19, and tested negative multiple times, and then tested positive. So again, it's a combination of the quality of the testing that we're doing and the way this virus works, that if you don't have a significant viral load, you won't show up on our tests. So again, you can't put a whole lot of faith in the actual testing.
Yeah, it's a conundrum, right? Because we're trying to use data to make decisions, but
Right.
the confidence level in the data is not high. So this question, last night you seemed to indicate that we were entering a new phase and referred to the first phase in the past tense. So what, in your mind, were the indicators of the change in phases?
That was not my intention. We were going to incorporate phase 2, but we're still in phase 1. So phase 1 was really self-isolation and kind of a soft quarantine. Really shut everything down with the exception of purely essential services. And even for those essential services, seniors get them provided for them, so they're still isolated. The second phase is kind of the contemplation of reopening. The contemplation of a measured approach to what we can bring out and say, you can now do this again. Outdoor seating 6 feet apart, walking trails. I know we've talked about this before, and I don't sleep a lot. I'll tell you a funny story about sleep in a minute, but I did lose some sleep over closing the walking trails. And it's not as if it's my decision alone, so we're doing it collectively, but it kept me up at night. And I see every 911 call that gets made to the town, and it was only a matter of time before someone got plugged by a car on South Avenue because, and the interview was going to be, I used to walk in the park, but Mike closed the park and now I walk on the street and I got hit by a car. Fortunately, that hasn't happened. Drivers, thank you for being aware and conscientious when you're driving. But reopening the trails is kind of the first step. We'd like to be able to reopen our parks at some point. Unfortunately, parks are conducive to social gatherings, so we've got to be thoughtful about it. I think our first selectman just announced on Friday that we are going to hold off on the traditional celebration of Memorial Day, and we're going to hold off on our traditional celebration of the 4th of July. If just for a second, take a moment to think about how you can do 4th of July with 8,000 people coming into a park and stay safe. The reason why we made the decision today, and we got a lot of criticism for doing it early, is because a lot could change between now and July. Unfortunately, the commitments to have the 4th of July fireworks has to happen like yesterday. So we were at a point where we had to make some decisions as to whether or not we can do it. And before we commit, money to do it and, people to do it, we got to make sure it's doable. And with the information we have at hand, it was not prudent, and it's subject to change when the information gets better, but we can't make decisions on the fly like that. So that's what phase 2 looks like, is to allow certain things to, get back to some semblance of what they used to look like. It won't be exactly what they used to be. It'll be a fraction of it, but we'll get people back to doing some things slowly.
Yeah, thank you. I'm just, as you're talking about that, I'm thinking that here we are standing in this empty Morrill Hall, which any other year by this date, the Sunday before Mother's Day, would be full of white elephant furniture and linens and, housewares and jewelry for the Mayfair sale. And it's just quiet and empty. So it's an odd feeling for sure, but the right thing to do. So speaking of reopening, you've touched on this, but I think people would welcome a little more detail. When can retail businesses expect additional guidance with regard to reopening safely when we get there? The number of customers in the store, masks for employees, handling of merchandise, et cetera.
So we've already started in some small way by giving all the small businesses masks to repair themselves. I think, the May 20th deadline set by the governor is probably still a good date by which some restrictions can be thought about being relaxed. As far as what capacity of your store is going to be reduced to, remains to be seen. I think if people want to have, and every building and every space is going to be different, but if people want to get a framework in their mind, we're thinking somewhere between 25 and 50% capacity as a general rule, but it'll really depend on what people think is safe within their store. And what I'm hoping is that in a town like New Canaan, the store owners won't have to police it necessarily, but I think people will say, hey, there's 12 people in the store, I'm not going to go in until someone comes out. And I think that's going to happen. I really do think people are going to start to really appreciate their own safety and what it means to stay safe. And they're going to say, even though I can go into the store, I'm not going to put myself in that position until someone else leaves. And I think we're going to start to see that happen more and more. So nothing's set in stone yet, but if you could, figure out a way to queue people up and have appointments, things like that are very smart to be thinking about.
Okay, good. Thank you. And again, something else I think you've touched on, but worth repeating. So somebody observed that yesterday at the transfer station, only about half of the people there were wearing masks, but the week before, almost everyone was. And do you think that that's a sort of a leading indicator of people kind of relaxing?
Do we know if it was staff or it was people visiting the transfer station?
People using the,
So
residents coming to use it, yeah.
Yeah, so my message to residents is to wear their masks. No one likes me to tell them what to do. I don't get to do it at home, so I don't know why I'd be able to do it here. But you need to wear a mask. I think if you, and I think we said this last week, the very first day when a beloved member of your community, our community, that passed, everyone was trying to be a civilian sleuth to figure out where that person had been and who they'd been in touch with, and they were doing their own amateur contact tracing. That's no longer able to be done because there's too many people that are infected. But this whole mask thing, if it's not cool to wear a mask today, it will be tomorrow. People are going to start to really embrace this whole mask, and there'll be customized masks. The Lone Ranger,
I mean, how could this not be cool?
the Lone Ranger to my left
I
here,
really, I think I look better with this thing.
I think people are, if I were an investor, I'd be buying masks and I'd be shorting lipstick. No one's gonna be wearing lipstick anymore. So, at least for a period of time. But I think once people start to realize that masks are gonna be the new fashion statement, you're gonna see the Gucci mask and the Lilly Pulitzer mask. You're gonna see people start to really embrace this. And they should, because masks are going to be here for, I would say, a year's time frame is not a stretch by any means.
Yeah, that's a big piece of news, just as things that come out of Mike's.
Lilly Pulitzer mask?
I like the Lilly Pulitzer mask.
Masks for a year, okay. So,
well, I think masks are going to be appropriate until there's a viable vaccine, or until we have real bulletproof therapeutics that you say, if I get sick, I get a pill and I'm going to be okay. Until we're there, I'll be wearing a mask.
Yeah. Do you recommend, so as you noted, states border each other, people move back and forth between states, particularly in this part of the world. Do you advise people to find out what the executive orders are in a state where they're going before they go there? And also noting that most Rhode Island borders, they stop and ask where you're going and how long you're going to be there, and why don't we do that in Connecticut?
Again, that's a state issue, so you'd have to ask the governor that question. I think, to give credit where credit is due, I think as a result of the failure of the federal government to take a holistic approach for the nation, I do give the governors of Massachusetts, Rhode Island, New Jersey, New York, Connecticut a lot of credit for kind of regionalizing kind of their decision making. I think it makes perfect sense. I mean, what good is having a law that is in place in Connecticut when everyone commutes in New York for work? People need to be aware of what the conditions are and what the standards are in their respective work and home life. So I think err on the side of caution. I think if you have the opportunity to not wear a mask because you're going to a state does not mean you should not wear a mask. People can make decisions for themselves, but I can speak for myself, and I will err on the side of protecting seniors and at-risk populations at all times. If you're brushing your teeth, you can't wear a mask. It's been told to me that it's hard to smoke while you're wearing a mask. Good, you probably shouldn't be smoking in the first place, but that's not a decision I get to make for you. But if you want to be out, I'll be wearing a mask, and I hope by leading by example that will help others to make an easier decision. And I think kids will wear masks. I think that's a big myth. I think people think kids just won't do it. Kids are going to be the first adopters. I can't back out of my car, out of my garage without a seatbelt on because my kids are like, Dad, seatbelt, seatbelt, seatbelt. I think young kids will be the first adopters of this, and we'll all learn from them, which is good because they're also spreaders.
We got time for one more here, Jim.
You got time for one more. Okay. How to choose. People are wanting to do the things that they want to do. So what do you say about things that require close attention, like getting a haircut? People are feeling very, very shaggy. The person has to be within 6 feet of you. What are your thoughts?
So again, I can only share with you my experience. I've got video that for the right price I will share with you of my wife taking direction from my kids on how to cut my hair while she's watching a YouTube video on how to cut hair. I'll be honest with you, I love the individual who cuts my hair. I've been to for years, a good friend. He and I may have a different relationship going forward because I don't think I look that terrible, and it costs nothing other than a lot of laughs in our house. So decisions and risk-taking is an individual decision. I think the governor is clearly going to open salons for one-on-one contact. If you want to go get a manicure or your haircut, I'm not going to stop you, but I think you got to decide how much risk you want to take for your nails and your hair. And again, listen, I live with a lot of women in my house, and they're not letting me cut their hair. I offered to reciprocate, and that went nowhere. So I think people have to make the decision that's best for them.
Yeah, wow. So everybody, thank you, Jill, and thank you everybody who's done this to get your questions in. And I hope if we missed a question that we'll pick it up next week. And Mike, we're grateful to you for making this your hot stop, Sunday morning wildness as you come out here while we're all so far apart. And we're grateful to you for coming in and sharing what is on your mind and on your heart. You represent so many of the leaders of our community and so much of our community, and you really edify us about the mega trends and the mega streams as we seem to negotiate our way forward here. So our Thanksgiving is to you. Our Thanksgiving is to the whole community. Our Thanksgiving is to those that are not named in leadership positions, those who are laboring at the Waveney Care Network to change sheets and clean rooms. And we're grateful to our hospital workers. And we're thankful that it's springtime and the sunshine comes out. So peace and blessings, everybody. Thank you for being a part of us. We'll see you next week. Take care.